The human gut has approximately 10 to the 14 bacteria consisting of 1,000 to 1,200 different species. The variety of bacteria in the gut is useful for the metabolism of bile, for the fermentation of carbohydrates, and for the competitive exclusion of certain pathogens. Refractory and recurrent Clostridioides difficile infection is treated with a long duration of antibiotics which alters the gut microbiome, rendering the competitive exclusion of certain pathogens less effective. Fecal microbiota transplantation is approved for the treatment of refractory and recurrent Clostridioides difficile colitis, as transplantation replenishes the normal gut microbiome. Fecal microbiota transplantation is also used experimentally for the treatment of hepatic encephalopathy and for the prophylaxis against acute graft versus host disease in patients who undergo an allogeneic hematopoietic stem cell transplantation. Gut bacteria is thought potentially to cause hepatic encephalopathy, and gut bacteria is thought to increase the likelihood of graft versus host disease in patients who undergo an allogeneic hematopoietic stem cell transplantation. In the transplantation of feces, donor patients are screened for inflammatory bowel disease, human immunodeficiency virus, hepatitis, and gut feces are screened for vancomycin-resistant enterococcus, listeria, and rotavirus, among other pathogens. Notably, as of 2018, extended spectrum beta-lactamase Escherichia coli was not screened prior to fecal microbiota transplantation. In this report, 2 patients, one treated for hepatic encephalopathy and the other treated prophylactically after allogenic hematopoietic stem cell transplantation, developed extended spectrum beta-lactamase Escherichia coli bacteremia and subsequent sepsis upon fecal microbiota transplantation. The donor species was subsequently screened and found to consist of extended spectrum beta-lactamase Escherichia coli, and the genome of the bacteria was the same as that found in the 2 patients. The stool in 5 additional patients who received feces from this same donor was positive for extended spectrum beta-lactamase Escherichia coli. However, these patients were not symptomatic. New protocols now require the screening of donor stool for extended spectrum beta-lactamase Escherichia coli.